Hello, my name is Diana Isaacs. I am a clinical pharmacist and a diabetes care and education specialist at the Cleveland Clinic Diabetes Center. And for my blog, I chose to do a video this month. And I was looking at the different topics, right? Because it's the start of the year, brand new year, 2022. And one of the topics was goal setting. And I thought, well, I could sit here and, talk about strategies for setting goals, which is great. And I'm sure, well, maybe would be useful. But then as I was thinking about it more, we can set all the goals we want, and we should always strive to be better. But even with the best goals, the best intentions, the best plans, things can still go wrong. And we know they often do in diabetes because there are so many variables. And so that's why having a backup plan and being ready for emergencies is always going to be important, no matter what our goals are and no matter how prepared we are. So with that, I am actually going to segue into a topic you probably didn't think I was going to talk about, but that is the treatment of very severe low blood sugar or hypoglycemia, and specifically glucagon. So for a long time, glucagon, and it still is, under-prescribed. And I want to show you why. Because for a long time, we only had one type of glucagon. And it comes in this nice little container. This is a demo. And I want to show you how this works. Now, keep in mind, glucagon is meant for emergency situations. And what we describe as an emergency is typically when someone else needs to help you, when your blood sugar has gone so low that you are not able to think clearly, you are not able to eat or drink anything. And this can be a life-saving medication that can quickly cause your blood sugar to go up. That being said, the gold standard is if you can't eat or drink, do that. But this is a great tool for emergencies. So let me show you how this works. So there is a powder. There is a dry powder in this little vial, okay? And then there is a separate syringe that has a diluent in it. So basically a liquid. And then you're supposed to take this cap off, and this is a demo, although gosh, that needle looks pretty real. All right, so then I'm supposed to take this off. I wonder if this is really an old one, because this seems very real. Okay, so I am supposed to go ahead and put this diluent into the powder. And keep in mind, most people doing this are not trained healthcare professionals, right? So this might be their first time they're actually mixing these kind of things up, right? So I'm going to go ahead and putting it in there, putting it in all the way. Keep in mind your person you're doing this for is passed out right now. So your hands might be a little bit shaky, right? And then once you've done that, the key is next, you've actually got to kind of mix it up, right? Because you don't want to be injecting powder. So you actually have to mix it all up and make sure it's mixed, because you want it to be mixed, right? So after you've done that and you feel like it's kind of mixed well enough, I guess, then you got to go ahead and you still got to draw it back into the syringe. So I'm going to go ahead and I'm going to put some air into this, right? Because it's always easier to draw something out when you've got some air in. And I'm going to put it all the way back. Be careful not to get too many air bubbles. Oh gosh, I got so much air and I didn't even get the liquid out. I just got lots and lots of air. Oh my goodness. I'm not doing well. And I'm a pharmacist. I should really know how to do this very well. Maybe because this one's so old. Well, I feel like that's probably good enough. Oh, keep in mind, the person I'm doing this for is totally passed out. Yeah, every second counts. Every second's very important. And I'm just wasting lots of seconds trying not to get too many air bubbles. Oh my goodness, this is stressful. Okay, there's still a lot of air bubbles, but now I'm going to go ahead. Don't love needles. This is a really big needle, by the way. I'm going to go ahead and put this into the person that is passed out. Okay, time out. That was a lot, right? I would not want to do that in an emergency situation. And in fact, when I've presented that to my patients, what they say to me is, I'd rather just call 911 and wait for the ambulance. So that clearly is a problem. Now, the good news is within the last couple of years, we've gotten way better formulations of glucagon. But I get so upset when I see that this is all people have, or people don't have any glucagon because they didn't know that there were easier formulations. So let me walk you through. So we now have a nasal glucagon. And this is different because the other glucagons need to be injected. Now, people with diabetes that need glucagon are usually used to injections because they're giving themselves insulin, but still for their caregivers, this may be a nice option because they may not be as comfortable with injections. So this literally goes right into someone's nostril, and then you just press down like that. Now it's a dry powder that goes in. The person does not need to breathe any air. They've even done studies when there's nasal congestion. It works just fine. So that's a nice, easy to use option. It's approved for ages 4 and over. But now we also have 2 versions of pens that are much easier to use. So we have both Gvoke, and then we also have dasiglucagon or Zegalogue. And let me show you how these work. They're both very, very, very similar. And you kind of think of them, I think of them like EpiPens, or if you've ever used a Trulicity pen, very simple like that. So I'm just going to show them together because they're very, and these are demos. These are true demos. So they won't look exactly like it, but they're pretty close. So you see there's these little caps on the top, right? So I'm going to go ahead and I'm going to pull off that cap. And then that yellow part is the part that you go ahead and inject. And in terms of places that it can be injected, we're looking for the subcutaneous area. So same places that insulin can be injected. So back of the upper arm, abdomen, at least 2 inches away from the belly button, fronts or the sides of the legs. And then I can just go ahead, let's say we're doing my arm and like that, I'm going to hold it there for at least 5 seconds. I believe one of them on the label says 5, the other one says 10. You can't go wrong holding it for longer, but hold it for at least 5 seconds, and then boom, that dose has been given. And the other one, just to be fair and show both of them, I'm going to take that off. Same concept, putting it in there and making sure I hold it there for that 5 to 10 seconds. If you count fast, definitely do 10 seconds. Now, some things that are very important related to glucagon, and that is that once someone gets glucagon, we do expect that their blood sugar is going to raise pretty quickly. Typically, we say up to 15 minutes to experience the full effect. So a couple important things about that. If someone has not woken up after 15 minutes, it is okay to give a second dose. The second thing about it is when people wake up, they often may feel nauseous. So if someone is lying on the ground, you want to roll them to their side so they don't end up throwing up and choking on their vomit. The other thing is if someone's passed out, good idea to call 911, regardless of what you do or what happens. Now, the last thing I want to show you is that in addition to these pens, which I would say the pens people really like, I did just want you to know that there also is a pre-filled insulin syringe. This actually became available before the pen became available. And so similar concept. This is ready to go, pre-filled syringe. You go ahead, find the area. You could go ahead and squeeze it a little bit if you want, and then you're going to go ahead and put this directly in there. So lots of options. I'm told there's also going to even be a vial, but the big thing that's so important about these new pens and the pre-filled syringes and all that is that they don't require any of that crazy reconstitution that you saw with this. I mean, that's absurd to expect that someone in an emergency situation is going to be performing chemistry, right? Way too much to ask. And because this is all we had for so long, there are so many people out there that don't have glucagon that should have it. So who should have glucagon? We hope no one needs it, but anyone who is taking insulin could be at risk of a severe low glucose event. For sure, anyone who's on multiple daily injections or insulin pump therapy. So that's going to be anyone with type 1 diabetes. Many people with type 2 diabetes are taking insulin also. These people also deserve to have glucagon. And many of these, they're shelf stable now, room temperature for up to 2 years, depending on the formulation. So if you don't have glucagon, talk to your healthcare team about if you should have it. And I would say if you're on an intensive insulin regimen, it would be definitely good, better safe than sorry. So with that, I'm signing off. Thanks so much for listening.